Hello, my name is Kenneth Alexander. I'm Chief of Pediatric Infectious Diseases at Nemours Children's Hospital in Orlando and Professor of Clinical Sciences at the University of Central Florida. I'd like to spend some time discussing the new COVID vaccine indication for children ages 5 to 11. These are exciting times for us, for those of us in medicine, for those of us caring for children, for those of us raising children. We've really looked forward to this for a long time. You realize that as we started talking about the COVID pandemic back in January of 2020, we'd have all given our eye teeth to have vaccines. Well, now they're here. Just so everybody knows, this is being recorded in early November. The FDA has granted an emergency use authorization for immunization of children 5 to 11, and the CDC and Advisory Committee on Immunization Practices has provided a recommendation. So let's talk about what this means for kids, and we'll go from there. Because what we've got to talk about with families is not just the usual things about vaccination, but we need to spend some time talking about the emotional aspects of vaccination. Yes, we've got to answer their questions about side effects. They may ask us what an mRNA vaccine is, but really, as providers, as we talk to families, we have to convey to families the importance of protecting their children, because that's the right thing to do, and protecting the adults in the communities in which our children live. So it's always interesting as you talk with parents that the discussion often begins with, why should I vaccinate my kids, right? Many parents realize that compared to what we saw in adults early in the pandemic, COVID-19 in children doesn't seem to be that bad a disease. We don't see high mortality in children. But in fact, we do. With the emergence of the Delta variant, we saw a change in the behavior of this virus. Yes, early in the pandemic, all we talked about was nursing homes, old people, and the elderly certainly got clobbered with this virus. But what we've seen as time has gone on is that this virus has formed new variants, and the Delta variant, well, the Delta variant is just really smart, because what it's figured out how to do is really affect our children. And we realize that affecting children from the perspective of a virus is a very smart move, because we open our homes to our children, we hug our children, we kiss our children, and we welcome children all through everywhere we go. And so by becoming more of an infection in children, COVID-19 has found a way to drive the pandemic forward. So why is it important that we vaccinate kids? First of all, of course, kids do get bad disease. Yes, most kids that get COVID don't get severe disease, but we do realize that for children 5 to 11 now, COVID-19 is the number 8 killer of children. We see acute COVID acting like a bad viral infection. And I can tell you, I've had the unpleasant experience of watching a child die of acute COVID-19. And then there's this mysterious inflammatory syndrome, MIS-C, multisystem inflammatory syndrome in children. And at our hospital, we've seen somewhere around 30 to 40 cases of these kids who come in, some of them terribly ill with severe abdominal pain, some with myocarditis, lung disease, bad fevers, rashes. These kids are sick. So don't let anybody tell you that COVID-19 in children isn't a big deal. And then the other reason to vaccinate is to protect our families. I already mentioned that we welcome children into our lives. Parents, grandparents, aunts and uncles, our businesses. And that brings the third reason, to protect our communities. Everyone with whom our children come into contact, teachers, people at church or synagogue, all the places we go every day. because vaccinating children is going to be an important part about getting us all back to work, getting society back to normal, getting back into the restaurants, the theaters, the stadiums, all the things we love to do. The next thing that parents ask then is, well, okay, you've made a case for vaccinating. Does it really work? And if you look in the clinical trials data for the Pfizer vaccine, what we see is that these vaccines in children 5 to 11 are 90% effective for preventing symptomatic COVID-19. So let's get into some of the details of the clinical trial. So again, we're talking about the Pfizer BioNTech COVID-19 vaccine. This was a phase 2-3 randomized controlled clinical trial. And so what they did was they randomized 2 people to the vaccine for every child that got placebo. The median follow-up was a little over 3 months. Here's the bottom line. Vaccine efficacy against symptomatic lab-confirmed COVID-19 was 90.9, almost 91%. So they saw 3 cases in the vaccine arm and 16 cases in the placebo arm. So what that means is there was a 90% reduction in symptomatic lab-confirmed disease. Antibody titers were good and met the non-inferiority criteria that they saw when they compared it to vaccine titers in older kids. The other thing we have to remind parents is that there's a truism that vaccines don't always prevent infection, but they attenuate disease. And that's why we know from older populations that even though the vaccine doesn't always prevent infection, the vaccines are very, very effective at keeping people out of the hospital. Indeed, while only about 60% of our population in the United States is vaccinated, more than 90% of the people who are being hospitalized are unvaccinated. The next question that parents will ask you is, all right, is it safe? Why should I give this vaccine to my child? How do I know it's safe? Well, here we've got several things on which we can hang our hats. First of all, there's the experience to date in everybody else. In the United States, we have given a total of over 432 million doses of COVID vaccine. And roughly 224 million people have had at least 1 dose. So if a parent looks at you and says, I don't want my kid to be a guinea pig, well, if you're a guinea pig, you're guinea pig number 224,000,001. There's a lot of experience with these vaccines, and we understand now what these vaccines do. Granted, most of our experiences are in adults or in older children, but we have every reason to believe that this also applies with younger children. Let's talk about the safety results of the trial for a moment. In the clinical trial, no serious adverse events were seen. There were no fatalities. There were no reports of myocarditis. Kids did really well. There were, as you'd predict, local reactions. Arm swelling, a little bit of redness, pain at the injection site, and the predicted systemic reactions, fever, maybe some nausea and vomiting, headache, fatigue, chills. Overall, 2.7% of the children in the vaccine arm and 1.1% of children in the placebo arm had minor adverse events. So what does that mean? So far, it looks like the safety of this vaccine is comparable to what we've seen in other children in older age groups. Now, one of the concerns that comes up is, what about myocarditis? As you recall, we've seen concerns about vaccine-associated myocarditis in older children. If you look in the VAERS rate per million doses, females 3.9 per million doses, males 39.9 per million doses. So that's per million second doses. So in males, about 40 per million. We don't know yet the rate of myocarditis in younger children. We do believe that the rate of myocarditis is likely lower. We will continue surveillance to see if there is myocarditis associated with COVID-19 vaccination. But we do know that myocarditis is associated with COVID-19 disease. Then parents will say, well, what about long-term? How do I know there's not going to be some sort of long-term problem 20 years from now? I'll grant that's a tough question. And in fact, the only way we're going to know for 100% sure is to wait 20 years. There's a problem. People are dying now. We need the protection now. So what do you say to parents? Well, there's a couple of things we can say. First of all, in the adults and people that have had vaccine, for some folks now, we're out 2 years and no one has seen any long-term effects except protection against disease. People who get vaccinated don't get sick. The other thing to keep in mind is, can you think of any episodes of any vaccine that has long-term effects? Now, yeah, we can talk about the swine flu vaccine in the 1970s and talk about Guillain-Barré, but even there, that was just a few weeks after the vaccine was given. As I think about it, I can't think of any examples of long-term effects due to vaccines. And if they do happen, they must be incredibly rare. And here I think we have to help parents think about it some. One of the ways to think about it is this. Remember that when parents refuse to vaccinate because they're worried about the potential of a long-term effect, they are trading off the theoretical and probably terribly, terribly unlikely possibility of a long-term event and are losing the 100% proven, we know it's good benefits of the vaccine right now. That doesn't make a lot of sense. And in fact, let me draw a parallel for you. For me to say I'm not going to vaccinate my child because I don't know what's going to happen to them 20 years from now, this is a little bit like me saying I'm not going to accept my paycheck this month because I might spend $1 in the lottery and I might win big in the lottery, and then somebody might rob me. Parents are trying to trade off an uncertain, very unlikely risk at the expense of proven benefit for their children now. So we have to address that sort of error in thinking. And then when you put it all together, parents want to know, all right, what's your recommendation for my child? Don't be mealy-mouthed here. It's interesting. If you follow the old saying that actions speak louder than words, what you see right now, early as the vaccine for children 5 to 11 has come available, is that medical people are flocking in to get their kids vaccinated. We, the people most concerned about children, our children, are getting them vaccinated. So what's our recommendation? Yes, get the kid vaccinated. Now, here we have a problem because there's lots of social media chatter out there. And here's where we have to build on our relationship with parents, because you and I appreciate that in social media and the press, the deviant opinion, the minority opinion, gets a lot more attention than the majority opinion, the opinion that's based in well-reasoned science. So what we have to do is remind parents where to go for the right kinds of information. And we have to remind parents that the opinions that they hear against vaccination, although they may be the loudest, are actually the minority opinions. In some ways, in the vaccine world, what's the saying? Walk softly and carry a big stick. Well, we walk softly and carry an effective vaccine. So what we have to do is remind parents that healthcare providers, we are vaccinated, and the people that we love are vaccinated. Now, there are parents who will say, well, dang it, it's my right to decide. I'm the parent. I know what's best for my child. Well, yes, it is your responsibility to make decisions. But what I want to do is suggest that we turn to parents and say, well, the real issue is not, I'll do what I like for my child, but reminding parents that they have a duty to protect their children. Getting your kid vaccinated is just like putting your kid in a car seat, making sure they don't choke, making sure they wear a seatbelt in their high chair, making sure the bath water's not too hot, making sure that they have safe care. Being vaccinated is what we do for the people we care the most about. So what we want to do is change the conversation to a sense of duty, to a sense that this is the kind of thing that parents who love their children do. We all appreciate that for adult patients, going to get vaccinated at the pharmacy, at the grocery store, at the health department, that's the kind of thing that we don't even blink about. And it looks like we're okay with teenagers getting vaccinated at school or at the pharmacy. We don't really know yet how parents are going to respond to getting their 5 to 11-year-old children vaccinated outside of the medical home. We are working at getting vaccines into the medical home, and more, I think we will see pediatric and family medicine practices vaccinating younger children. But for the time being, we as providers have the difficult responsibility of advocating vaccination, even though we're not the ones giving the vaccine. We're going to advocate for vaccination and say, get your kid to the pharmacy and get them vaccinated. And we know that our pharmacy colleagues, well, they're as committed as we are. They want to do the right thing. They will do a good job. So if a parent's ready to go, well, we may have to ask for just a little bit of patience. And by the way, don't forget they need a flu vaccine. And if you're a parent who's just terribly frightened because of all the things with social media, get off social media. Let's find a better source of information. Go to the Immunization Action Coalition. Go to the Academy of Pediatrics or the Academy of Family Physicians. Go for good information. But most importantly, talk to your child's provider. And we want to remind parents of the danger of waiting. Because if you're sitting on the fence, this virus could well knock your child off that fence. Now, again, it's not all about the information. Information's important, but it's your emotional message, your strong recommendation that ultimately carries the day. And while I don't wish it on anybody, we worry about them seeing all these terrible things, acute COVID and MIS-C. We need to vaccinate our kids to protect our kids, to protect our families, and to protect our communities. This is what's going to get us past this pandemic and get us back to life as we know and love it. And there's the key word, love. I always teach my pediatric residents that immunization is a gesture of love. I sort of joke with them to say, only vaccinate the children you love. But I'm really kind of serious about that too. Immunization is what you do for the people you care about. So with that, thank you for your attention for this Medscape program. And I certainly encourage all of you to take a few minutes and fill out the post-test. And again, good luck, get out there, do the right thing. Let's get these kids vaccinated.